How long would you let a 7-pound weight sit on your finger? If you're not sure, go ahead and grab one, see how long, let me know. But I'll bet it's not very long. Hey gang, it's me, it's Dr. Jeff, your advanced trained non-surgical disc specialist and clinic director here at the Midwest Disc Clinic here in Shipshewana, Indiana. I'm also a 20-year plus chiropractic veteran and still going strong. It is my purpose, welcome to this channel, Dr. Jeff's YouTube channel, Never Look Back Pain, to share with you information and give you advice on what is causing your back pain, how to figure it out, how to find out, and solutions to it. Today, the question is this: how long could you go with a 7-pound weight crushing your finger? I bet you probably couldn't go very long at all. Why? Because if that weight is crushing your finger, it is going to cause a decrease of blood supply to the tissues in your finger. Over time, the tissue will die and it's going to cause pain. Well, why do we have pain, numbness, and tingling either down an arm or a leg with a disc herniation? You see, the disc is the cushion in between the bones of your vertebrae or in between your spinal bones. And when they bubble out like this, you can see the disc is bubbling out and it's pushing up against that little yellow nerve. The disc is the red bubble pushing up against that yellow nerve. And what happens is that disc will put pressure on the nerve. Now, the nerve has blood vessels, tiny little blood vessels that bring nutrients and oxygen to that nerve down the arm and the leg that make it feel and function. So let's look at the numbers and the stats here. Kind of crazy. At 1/10 of a pound, at 1/10 of a pound of pressure on a nerve, that's equivalent to cutting off the blood supply by 20%. So put a weight on your finger and cut it off by 20%. Over time, it's going to get sick and die. Same thing with the nerve. So if you have pressure equivalent to 1/10 of a pound on a nerve, you lose 20% of the blood supply to that nerve. Now, if we go 0.96 pounds, just under 1 pound, research has shown that we lose blood supply to that nerve 100%, meaning the blood supply is cut off completely. So let's give you an example. Don't do this, but if you were to do this, hold your breath, you're getting no oxygen, over time you will die. Same thing with the nerve. The nerve starts to die when it loses oxygen. At first, you have something called neuropraxia. Neuropraxia means numbness and tingling, and then over time, you'll see that wherever that nerve goes to, the muscle starts to die, because that's how you know the nerve is dying. Now, a disc herniation, the bubble, the red bubble sitting on that nerve or compressing that nerve, a disc herniation is equivalent to 7 pounds of weight crushing the nerve. Remember when I said put a 7-pound weight on your finger? Well, a disc herniation is equivalent in millimeters of mercury to 7 pounds of pressure crushing a nerve. Remember, 0.96, just under 1 pound, will cut it off by 100%, and now we've left 7 pounds of pressure on that nerve. It depends upon how long the pressure is there, whether or not that nerve can come back. We call it regenerate. So the reason you have pain, numbness, tingling is because you have cut off the blood supply to that nerve, and over time it loses its life and it starts to go to sleep, numbness and tingling, and then it starts to die. Now, once you get the pressure off the nerve, and there's multiple ways to do that, I'm not going to describe that today. In my office, it's a non-surgical way, but as soon as you get the pressure off the nerve from the herniation, a nerve will heal 1 millimeter a day or 1 inch a month. So healing the sciatic nerve that goes all the way down your leg is a really long nerve. It can take up to 18 to 24 months once you get the pressure off for that pain, numbness, and tingling to go away. So the moral of the story is, if you wouldn't let a 7-pound weight sit on your finger all day long, that is what's going on with a herniated disc. You must get the pressure off. There's multiple ways. In our office, it's non-surgical, but you also must realize as soon as the weight comes off, it takes a millimeter a day or an inch a month. You must feed it some nutrients, you must get water in, and you must feed that nerve some nutrients in order to heal. There's B vitamins, there's multiple things I won't go into today, but I just want to share with you why you have the pain, numbness, and tingling down an arm or a leg due to a disc herniation. I'm Dr. Jeff. I'm also the author of this little book right here, Never Look Back, A Simple Guide to the Cause and Care for Back Pain. Why did I write this simple little book? Because people are suffering. I still have patients every day that come to my office after surgery and still don't know why they have the pain. It is our primary goal to diagnose what part of your anatomy of your spine is causing pain, and usually it's multiple parts. In this book, I share with you what a normal, healthy spine should feel like and look like. We share with you what causes spinal damage. We share with you the tests that your doctor should be running immediately, regardless of insurance. And if not, you need to fire them and find a new doctor. And then we talk about a non-surgical solution. Plus, we talk about ways you unknowingly hurt your back every single day, including going to the gym, and ways to reverse that. Never Look Back. This is the name of the book. You go to neverlookbackpain.com and grab a copy. I'm Dr. Jeff, an advanced trained non-surgical disc specialist and chiropractic veteran who's passionate about teaching you how to about getting out of neck and back pain and living your life back pain free, because when you get out of neck and back pain, you never want to look back. Praise God. I'm Dr. Jeff. Have a blessed and fantastic day.